Hi, this is Erika from the Center for Reducing Health Disparities, and I'm here with another community spotlight. Today we have Bishop Tony Minor. He is one of MetroHealth's finest as the manager of faith-based initiatives here at MetroHealth. So he's going to talk to us a bit today about his role and his department and how they've been responding to the COVID-19 pandemic. How are you this morning?
I'm doing fine. Thank you. Thank you. Thank you for having me.
No problem. No problem. So share with our viewers a little bit about you and your role here at Metro.
Yeah, thank you. I serve as a manager for faith-based engagement, faith-based initiatives. And basically what I do is attempt to link the faith community to the hospital and its programs in a, what I call a bi-directional way. So it's not just our going out and pulling them into our program, but it's bi-directional in that they work with us and we work with them. So we also attempt to help them accomplish their goals and their dreams as well.
So what did some of that programming and some of those initiatives look like pre-COVID? What were some of the things that you all did?
Well, one of the signature programs that I was working on was our trauma support program called Project Thrive, where we were training community-based trauma ambassadors. These were individuals who would learn about trauma, trauma-informed care, and they took those skills into the community to support persons impacted by trauma. One of the other things, and the main role that I have, is to really run and operate open houses with the faith community, bringing them into the hospital, especially around our transformation plan with the building of the new hospital, getting them to understand what we're doing and how we're attempting to really provide quality services to all people. I also operate what's called the Clergy Cabinet, and that's a group of clergy who meet with Dr. Akram Boutros, where there's a conversation about what the hospital is doing, and they serve as a good voice to help the hospital be connected to the emerging needs in the community. So, you know, those are ongoing things, and there are programs, a host of programs around the hospital, and very often they're trying to get into the community, and the faith community becomes a good conduit. And so I'm always matching programs to the faith community.
That's awesome. With a large institution like MetroHealth, it's really important to have those folks who are on the ground, trusted, and know what organizations and people.
Absolutely. Absolutely. Yeah, so, absolutely.
March 2020, you know, our year so far it's been a lot to handle. How has that all shifted within your role? What has changed?
Well, I think it's certainly increased the importance around education. You know, when you're dealing with high-risk communities, and although we're in a pandemic, some of these communities are always in a traumatic situation, okay? And certainly COVID-19 is a very dangerous illness because people can die pretty quickly. And so it changed the way in which we interacted. And so there was not as much face-to-face, but I think it has really created a new platform. And I think the online platform and Zoom, the WebEx, and I think it's a tool that's here to stay, and I think people are using it very effectively, and I think it's worked very, very well. But it does speak to one of the problems with COVID-19 is the lack of human touch, and that's an element that we're going to just have to deal with over the next coming years, and maybe for a very long time.
Yeah. So it's good that you mentioned that. I know we call it social distancing, but really it's physical distancing. We don't want to distance socially at all, you know, and I think a lot of us are coming together a lot more socially, even with the distance being between us. So you mentioned the need. The need was already great in our communities, especially when we look at MetroHealth's patient population and those communities that they serve. There's a great need already. So in the midst of the pandemic, where does your programming lie now? You mentioned some testing and awareness and how do you address isolation? So what are you guys doing?
Yeah. Well, see, let me go back to just the whole question of a pandemic, right? And so since March, um, many in the community are facing a triple pandemic, a pandemic of COVID-19, a heightened pandemic of police brutality, and a heightened awareness and understanding of the virus of racism and systemic oppression. And so when you look at when you marry those three, especially in high-risk communities of color, right? It really intensifies the problem, and it intensifies the trauma, the anxiety, the toxic stress, especially for parents and African American males and young men of color. And so I think one of the things that COVID-19 really heightened our health disparities and our overwhelming awareness, and something we've been talking about and you've been talking about, the social determinants of health. And we're really seeing how detached people are from quality health care and how isolated they are. And I think over the last couple of weeks, last couple of months, one of the most important things that we've done, apart from involving the faith community in testing, okay, involving the faith community in community education, not just through people who attend their church, but people in their community, people that come through their community, educating them about the importance of taking key steps to protect themselves. The most important thing is, how do we use the frameworks and the tools to break the isolation? And I think one of the things that we're finding, especially among the elderly, and especially among them who have very chronic illnesses, is that many of these people are very poor, they are alone, and they are without a lot of supports. And so one of the things that we've done through our trauma program and through our healing circles is that we have really intensified comfort calls, giving people the skills and the tools and the inspiration to really call and check in on people, and to also increase the need for community care ambassadors. These are individuals who are trained and equipped, and these are lay persons. These are not necessarily trained pastors or nurses or doctors, but it's the village taking care of the village.
Love that. So you mentioned awareness. How is the community responding when you had your teams out there on the ground trying to talk about the importance of prevention? As a public health person, I'm kind of faced with multiple responses when it comes to my—
Absolutely. Yes, absolutely. So when you think of social media, for example, and all the tools that we have through the internet and YouTube, it's kind of a tale of two cities, because it's a place where you can get good information and it's a place where you can get bad information. Yeah. And so people are responding. It's really amazing that people are really influenced by conspiracy theories, and there's such a search for an answer, right? And one of the things that we've been doing with our community education approach is to inspire people to react to what we do know, okay? And so when you look into the community, you talk to people who are really trying to figure this out, right? There's so many conspiracies and so many ideas as to origin of it and what the causes of it is. Well, what we are attempting to do is to say to people, why don't you respond to what we do know? Mm-hmm. And what we do know is that if you wash your hands and you wear a mask and you socially distance, it reduces your chance of contracting COVID, right? That's the most important thing, right? And one of the other things, especially among young people, it's increasing this awareness that life as they know it in many of the high-risk communities, it's very risky anyway, right? So their hopelessness and their despair, they say, I could get shot on the corner. I'm not, while you want me to be worried about COVID, I'm worried about getting killed. I'm worried about the police that's stopping me.
It's just one more thing.
It's one more thing, right? It's one more thing. Well, from a moral, ethical standpoint, it's causing us to also get them to think about, do I care about others, right? So do I care about my grandmother? Do I care about my mother? Do I care about my brothers and my sisters? And so I must not only be concerned about myself, but I also must take some protection. I have an 18-year-old son who goes, I go through this thing of, challenging him not to hang out so much and trying to get a sense of what's the point of view of your peers, right? And, he's telling me that people do wear their masks and people are concerned, and he stays in his clique and I'm just with my family. And then getting him to understand that, yes, but most people do contract this illness from people they know, from their family and from their friends. And so none of that works in this environment. So I hope at the end of the day, it increases the community's awareness of what we've called and what we know as harm reduction. So this is without knowing it every day when we talk about wearing a mask and we talk about washing our hands and we talk about all those things, they are getting a quick one-on-one on harm reduction. And I hope that it spills over to other things like smoking some cigarettes and active living and what you eat. And so I just hope that it's some long-term positives come out of this.
I do too. Yeah, it's very hard with communities that already lack trust in science and in the medical field. But like, we're living real-time science as it happens, and that is not an opportunity that many of us get to experience. It's something so huge on this large scale. So we're all just kind of living it out. I think that's very interesting. Are you all still looking for community care ambassadors?
Yes, we are. And so, people can certainly get in touch with me. They can send me an email at tminor2@metro.org. I hope that you would put that on the screen if you have that opportunity. tminor2@metrohealth.org. And while this is working along with the faith community, it is not exclusive to the faith community. And as we talk about the faith community, we're not talking about the faith community in the sense of its spiritual rituals. We're talking about its ethical values of community service and community empowerment. And so it's the faith community's external practice. And so when we engage people through the faith community, it's not trying to convert them, it's trying to walk along with them. And most of the churches that we recruit and that I actually recruit from day one, we want them to know that this is not about converting, this is about assisting and walking along. And so for those that want to participate and say, hey, I don't want to work in the faith community, or I don't want to work with those churches because I don't want to hear, I don't want to be preached to. Well, it's not about being preached to, it's about the community. And that's part of, it doesn't matter if one is Jewish or Islamic or Christian or whatever one's spirituality is. There's a sense in there of responsibility, of love, compassion, and community. And it's out of that praxis that this work occurs.
Yep, and we need that. We need those folks on the ground. So my ask for you is to please share with me so that I can share with, more people, any methods and ways and, language to use when trying to tap into our communities who are already oppressed. We are not all going through this pandemic the same. My quarantine is different from, a clinician at Metro, is different from a businessman. It's all different. And with that, we have to speak to communities differently. So just please share with me any ways that you have learned to address community members and
exactly. And here is a real quick one. It's to embrace and not to judge, and we have to, as we engage people in the community, we don't debate their starting point at the point in which we engage them, right? But for all of us, there's a starting point. And we hope that from that point, in a very non-judgmental way, that we try to share together and learn together and to embrace one another without shaming and guilting and judgment. And I think that's what pushes people away.
Yep, I love that.
Thank
So
you.
I thank you. I thank you for your work. I thank you for being out here and essential to our community with your staff. It's just really great work that you're doing to impact people who need that connection. So I certainly appreciate it. And thanks for sharing that with us today.
Thank you very much. And thanks for having me.
No problem.